Hi, my name is Patty Napolitano, owner of Wellness Cleveland LLC, and I'm a social worker with over 20 years of experience as a community visitor, helper, and individual family trauma therapist, and more than double that amount of time experiencing life as a sister, a mother, a friend, a grandmother, and a caregiver who knows what it's like to sit alongside someone you love who's lost in very big feelings or get lost in very big feelings all on our own. One of the most common exercises we do in a therapy session is practicing relaxation in an already relaxed state. That helps us learn. That's how we learn best is when we're relaxed. We actually learn the best when we play. So I do like to play quite a bit too. The feedback that I receive from my patients is that those are helpful exercises. However, these patients who are children aged 0 to 99, they say that practicing breathing exercises when they're overstimulated is extremely challenging on their own. So, sharing some of my favorite resources, today we're reading from the Anxiety and Phobia workbook. I'm working on relaxation, which is chapter 4, starting on page 65. The Anxiety and Phobia workbook was published in 1990 by New Harbinger Publications Incorporated, and the author is Dr. Edmund J. Bourne. This section is titled Abdominal Breathing. Your breathing directly reflects the level of tension you carry in your body. Under tension, your breathing usually becomes shallow and rapid and occurs high in the chest. When relaxed, you breathe more fully, more deeply, and from your abdomen. It's difficult to be tense and to breathe from your abdomen at the same time. Some of the benefits of abdominal breathing include increased oxygen supply to the brain and musculature, stimulation of the parasympathetic nervous system. This branch of your autonomic nervous system promotes a state of calmness and quiescence. Quiescence? It works in a fashion exactly opposite to the sympathetic branch of your nervous system, which stimulates a state of emotional arousal and the very physiological reactions underlying a panic attack. Greater feelings of connectedness between mind and body. Anxiety and worry tend to keep you up in your head. A few minutes of deep abdominal breathing will help bring you down into your whole body. More efficient excretion of bodily toxins. Many toxic substances in the body are excreted through the lungs in our exhale. It's more than just oxygen and carbon dioxide. There's a lot coming out in that exhale. If you suffer from phobias, panic, or other anxiety disorders, you will tend to have one or both of two types of problems with breathing. Either number one, you breathe too high up in your chest and your breathing is shallow, or two, you tend to hyperventilate, breathing out too much carbon dioxide relative to the amount of oxygen carried in your bloodstream. Shallow chest level breathing, when rapid, can lead to hyperventilation. Hyperventilation, in turn, can cause physical symptoms very similar to those associated with panic attacks. The two types of breathing are discussed in greater detail below. Shallow chest level breathing. Studies have found differences in the breathing patterns of anxious and shy people as opposed to those who are more relaxed and outgoing. People who are fearful and shy tend to breathe in a shallow fashion from their chest, while those who are more extroverted and relaxed breathe more slowly, deeply, and from their abdomens. Before reading on, take a minute to notice how you are breathing right now. Is your breath slow or rapid, deep or shallow? Does it center around a point high in your chest or down in your abdomen? You might also notice changes in your breathing pattern under stress versus when you are more relaxed. So as I'm reading right now, I tend to be a little bit shallower of a breather when I'm speaking publicly because most of your effort is on the exhalation of speaking. So when I breathe in, or when I feel myself feeling a little out of breath, a little out, or a little up in my anxiety, I know it's not stage fright. It's typically that my breathing is off. And so I actually imagine that I have a point just above my belly button, and then I'm pulling it out with a string on the inhale. So I'll go. So if you've ever blown out a fire or stoked a fire with a bellows has two paddles and a point that points at the fire, and you onto it. I imagine that sideways, if this is my belly button and this is my spine, I have a string from my belly button bringing it out, and then I continue talking. So noticing that you have shallower breathing, we move it down into our abdomen. If you find that your breathing is shallow and high in your chest, don't despair. It's quite possible to retrain yourself to breathe more deeply and from your abdomen. Practicing abdominal breathing, to be described, on a regular basis will gradually help you to shift the center of your breath downward from your chest. And again, this is not something we just practice when we're stressed. This is the kind of thing that's therapy homework that we try a few different types of abdominal breathing, and we're training our diaphragm, we're training our muscles, just like if we were training to be able to participate in a really big school bike ride at the end of the year. And we do just 15 minutes of practice, 10 minutes of practice a day, just to get our bones and muscles and tendons and heart and pulmonary system all together. We do the same thing with breathing because we're training our brains and training our physical body just the same way as in any other skill or sport. Regular practice of full abdominal breathing will also increase your lung capacity, helping you to breathe more deeply. A program of vigorous aerobic exercise can also be helpful. And I can tell you, I do a lot of deep breathing. So when I went back to my pulmonologist to get tested for asthma, my lung capacity is at 115% of lung capacity for a woman my size and age they would expect. And I said, it makes sense because that's all I do is just practice breathing all day long. So I have this superpower of relaxation breathing. All right, the next type we're going to talk about is about with shallow breathing, which is one of the underlying breathing patterns that can cause an anxious state all on its own with nothing else happening. So we counter that with breathing exercises. The next thing we're going to talk about is hyperventilation syndrome. And that is another kind of breathing that can cause an underlying state of anxiety even when nothing else is wrong. So we want to create in ourselves an underlying state of health. That's why I'm a mental health provider, because the goal of therapy is to teach you how to create this state of optimal health so that when stressful things do happen, because we know that's life, we're better able to cope because we're not starting out way up here with our anxiety. We're starting with a lower baseline. So when we talk about baseline functioning, that is the goal of these exercises. All right, if you have the text, which I can't recommend strongly enough, we are on page 68, hyperventilation syndrome. If you breathe from your chest, you may tend to overbreathe, exhaling excess carbon dioxide in relation to the amount of oxygen in your bloodstream. This is why, if you have been in a band or orchestra, beginning band songs are so short. They're about 8 bars long. And beginning band concerts are over pretty quickly, because a big part of what we're doing is learning not to hyperventilate when we perform on a brass instrument or a woodwind instrument where we're just focusing on that exhale and trying to take our inhales as quickly as possible. When we exhale that carbon dioxide, if you've ever played a wind instrument, you get very lightheaded, right? And dizzy and maybe feel a little pukey. That's hyperventilation. All right. You may also tend to breathe through your mouth if you are stressed. Again, these are biological imperatives. That's why we do it this way. The result is a cluster of symptoms, including rapid heartbeat, dizziness, and tingly sensations that are so similar to the symptoms of panic that they can be indistinguishable. Some of the physiological changes brought on by hyperventilation include increased alkalinity of nerve cells, which causes them to be more excitable. The result is that you feel nervous and jittery. Decreased carbon dioxide in the blood, which can cause your heart to pump harder and faster as well, making lights seem brighter and sounds louder. So sometimes we think we might have a sensory issue when really the very function of fear and cortisol is to increase your awareness of things coming in. So it can cause your sensory system to feel overloaded immediately when we have high stress and a cortisol spike. Mouth breathing and hyperventilation can also cause an increased constriction of blood vessels in your brain, which can cause feelings of dizziness, disorientation, and even a sense of unreality or separateness from your body. All these symptoms can be the way that people describe having a panic attack. So we're going to do one abdominal breathing exercise here. See, I practice a lot. The first thing I did was take a cleansing breath. So I imagine I'm blowing out a birthday candle and expel. Now, number one, note the level of tension you're feeling. Okay, so I like to check in on a scale of 1 to 7. 7 is the most stressful and 1 is the least stressed. I'm at like a 2. I'm pretty low on the stress. I'm in my happy place. I have my plants. I have all of you. I have my favorite book, right? So I'm at a 2. Where are you at? Take a moment. Pick a number. Okay, we have our number in our head. Now we're going to place one hand on our abdomen, and I like to go right above my belly button. I like my pinky finger to be over my belly button and palm just nice and flat. Now inhale slowly and deeply through your nose to the bottom of your lungs. In other words, we're sending that air down as low as we can. If this is our neck and this is our belly button, we want to go. If you're breathing from your abdomen and you have your hand on a rib or above your belly button, your hand should rise. If you are laying on your bed flat and you put your favorite stuffed animal on your belly button and you take a deep breath in, you should be sending that stuffy on a little ride. Your chest should only move slightly when your abdomen expands. In abdominal breathing, the diaphragm, which is a muscle that separates the lung cavity from the abdominal cavity, the diaphragm moves downward. In so doing, it causes the muscles surrounding the abdominal cavity to push outward. So we want to think we're like that bellows, right? We inhale, exhale. When you've taken in a full breath, pause for a moment, then exhale slowly through your nose or mouth, depending on preference. Be sure to exhale fully. Now imagine your lungs are a balloon that you want to inflate and then deflate all the way. So we're going to go. What does the nose look like? So what feels better for you? Maybe a 3-second inhale, 5-second exhale. I know someone who likes to go 4 seconds in, pause for 3 seconds, 7 seconds out. Sometimes we just do even breathing, 4 in, 4 out. So see what you like. Do you like 4 to 6 breathing? 1, 2, 3, 4, pause. 1, 2, 3, 4, 5, 6, pause. 1, 2, 3, 4, pause. 1, 2, 3, 4, 5, 6, pause. As you exhale, you can allow your whole body to just let go like you're turning into a rag doll. Maybe let your arms swing. Now I want you to do 10 slow, full abdominal breaths, trying to keep your breathing slow and regular without gulping in a big breath or letting your breath all out at once. Remember to pause briefly at the end of each inhalation. So we're going to count to 10, counting our breathing. And I'm a music person, so I'm going to go 1, 2, 3, 4. Breathing in, pause. 1, 2, 3, 4, 5, 6. Pause. 1, 2, 3, 4. Pause. 1, 2, 3, 4, 5, 6. Pause. 1, 2, 3, 4. Pause. 1, 2, 3, 4, 5, 6. Pause. 1, 2, 3, 4. Pause. 1, 2, 3, 4, 5, 6. Pause. Last one. Inhale, 2, 3, 4. Pause. Exhale, 2, 3, 4, 5, 6. So you can extend this exercise if you wish on your own, counting to 10 as you go. 4 seconds in, 6 seconds out. Some people prefer to count backwards from 10 down to 1, whatever you prefer, and let me know what you like in the comments. Thank you.